Hey there, it's Dr. Gill with Zenith Injury Relief and Wellness Clinic. Today I'm going to be talking about the most common condition we see in the office, which is lower back pain, and going through the causes of it, the actual condition, and then lastly, the treatment for lower back pain. So when people come into our office, we can do a thorough orthopedic neurological examination. We figure out what the cause is of the lower back pain. And typically I tell my patients it's life, right? What you do throughout your life from, being a kid, trips, falls, to sports injuries or playing sports, and even motor vehicle collisions can cause a lot of injury to the lower back, sprain, strain injuries. And then lastly, it's micro trauma. So sitting behind the computer desk for long periods of time and your posture overall on your iPhone or iPad can cause a lot of lower back pain. So the actual conditions, I'll go over the most common 5. So first is a strain, sprain injury from a motor vehicle accident. Typical treatment time is 4 to 6 weeks to get you back on your feet again. Another common condition is disc bulge, which I use the analogy of a jelly donut. So if you just compress a jelly donut, which is one of your discs here, sometimes that can cause impingement or pressure on your nerves that are coming out of your foramen. The next step would be a disc herniation. That's where the disc actually protrudes out of the actual disc and your vertebrae is then compressed. So once you have a disc herniation, most of the time it becomes bone on bone with your lower back and you start to develop bone spurs. And lastly, I also see patients in the office that have scoliosis. So from front to back, your spine is supposed to be completely straight. And sometimes either congenitally or idiopathically, we start getting curvatures in our spine. And that can create a lot more pressure on one side compared to the other. As far as common treatments, we have a conservative approach here in our office. So we like to start with chiropractic care, getting the spine moving, physical therapy, getting your muscles moving, and typically we're able to get you out of pain 80% of the time. And if that doesn't work, we have these specialists on staff and some referral partners that we can get you to. For example, pain management. So whether it's getting some medication or even pain injections in the back, that would be your second step as far as treatment goes. And then lastly, it would be surgery. Most of the time, we can help patients without surgery, and that would be the last resort for any of my patients. But sometimes it's necessary, especially if it's affecting your activities of daily living. That's when I would recommend surgery. So I hope to see you in the office, and thank you for watching.